Hello, I'm Adriana Palade, a neurologist specializing in epilepsy and sleep disorders with UofL Health. I spent my summers with my mother. She was a math teacher, and right beside the school was a neurological hospital. I made friends with one of the physicians there, and something unfortunate happened. He essentially lost his memory, and that intrigued me. I was 8 at the time, and I couldn't figure out what has happened to somebody so smart that was so debilitating, and it really kind of led me into neuroscience and trying to understand more about memory. I specialized in epilepsy and sleep. I'm fellowship trained in both of them. I think the two of them really interrelate very well, just because sleep is part of our everyday life, but epilepsy many times is worsened by sleep disorders. Sometimes it's as simple as changing medications to make somebody's epilepsy better. Sometimes it involves surgery to control their seizures. And sometimes it involves talking to a patient to realize what they do wrong and they don't sleep well at night. So they all interrelate. I think sleep is what makes us function during the day. It can have a tremendous impact on our everyday functioning and has impacts children in learning. It impacts our the way we communicate with each other, feelings, personality, everything. Neurology has evolved tremendously over the past few years. There are more and more medications. I think it's time that we all focus more on neurorestorative care to our patients. It's not enough to treat their disorders, but essentially see and try to influence how much this impacts their life. A lot of them suffer from their disorders because they lose their jobs or lose the ability to drive, but many times it impacts the way they care for themselves and their family. So I think we have to extend our care to try to improve their lives. I think we personalize very much the care we deliver to our patients based on age, gender, preferences, goals. But we also, I think we have a tremendous impact on the future because we train residents and fellows that will eventually be our own physicians. And seeing how we treat the patients will influence the way they practice in the future. I love gardening, cooking, spending time with my family, walking with my dog, and anything that has to do with nature.